Knock, knock. Come in. Hi, my name is Yessie. I'm going to be your nurse for today. I'm going to be performing an assessment on your heart and your neck vessels, as well as your skin, hair, and nails. Is that okay with you?
Yes.
Perfect. So I'm going to go ahead and close the curtain for privacy. I'm going to sanitize my hands for about 20 seconds, and then I will lift the bed for comfort and for safety of both myself and the patient. And I'm going to go ahead and identify my patient. Can I see your bracelet? Can you tell me your name and date of birth?
Sophia Garcia, 53001.
Perfect. So I'm going to go ahead and start with your skin. Do you mind if I take a look at your arms really quick? Perfect. So temperature is the same on both sides. The turgor is normal. I see no change in color, no changes in pigmentation. I don't see any lesions, bruising, or erythema or edema. I don't see any pallor or cyanosis, and everything else looks normal. And then I'm going to go ahead and start with the assessment of your heart and your neck vessels. Do you mind if you can turn your head to the side for me? So I don't see any distension of the jugular vein. And I'm going to go ahead and auscultate to make sure that I hear the pulse. Perfect. So the pulse is 2+, which is expected. Sorry, guys. All right, so I'm going to go ahead and inspect the chest. It looks symmetrical. There's no changes in color. I don't see any pulsations. I don't see any lifts or heaves. And I'm going to go ahead and start pointing out the precordial points. So I'm going to start at the clavicle, and then I'm going to look for the second intercostal space, which would be the aortic. And then on the left, second intercostal space would be the pulmonic. And then in the third would be the Erb's point. And then in the fifth would be the tricuspid valve, and then the midclavicular line to the fifth intercostal space would be the PMI, which is the pulse of maximal impulse. Excuse me, pulse of maximal impulse. What else would be?
Mitral.
Oh, and then the mitral valve would be as well in the fifth intercostal space. Then I'll go ahead and auscultate those points. So breathe in. Breathe in. Sounding the bell. Sorry. Perfect. So I heard regular S1, S2, which is the leapt up sounds. I didn't hear any crackling and no murmurs. And it sounds normal with a 2+ expected pulse.